let's settle in for a heart-to-heart. This is one of those topics that brings up a lot of fear and uncertainty, especially if you're preparing for vaginal birth for the very first time. Today, we're going to be talking about perineal tearing and episiotomies. And what's the difference between the two? I know, it's not exactly glamorous or all that fun to talk about, but I promise you that understanding what's happening down there and what might happen can give you a deep sense of empowerment, clarity, and a sense of calm in the storm. Of course, as I always say, this is your body. You have every right to know what's up and what's down. So, hypothetically, let's make tea. Let's take a breath and let's chat like we're curled up on the couch together talking as I would if I were your doula. Love and blessings, beautiful people. My name is Elizabeth Vanderwalt. I'm a holistic doula and a women's health coach, currently residing in the prairies of Saskatchewan, Canada. But I help people worldwide, virtually and in person as much as possible. Let's dive into a very serious topic, and at the same time remember that I'm not a medical professional, so everything on this episode is just to share with you any tips and encouragement along the way. Let's talk about what an episiotomy is. First off, this is going to get a little nitty-gritty, so let's be prepared here. An episiotomy is a surgical cut made in the perineum, which is the space between your vaginal opening and your anus. Yes, during childbirth. So years ago, it was pretty routine. I think it still is. Doctors believed that making a clean incision was better than a natural tear, that it would heal easier, cause less damage to your pelvic floor, and help baby get out quicker. But here's the truth. Modern research tells a very different story, where we've learned that natural tears can often heal better than a surgical cut, and that means routine episiotomies. They don't actually prevent long-term issues like incontinence or prolapse like we once thought. So today, episiotomies are not considered standard practice anymore, as we say. They've used more selectively, especially when baby is in distress, or if forceps or vacuum are being used, and a quicker birth is absolutely necessary. Or if you choose to add it to your birth plan as something you'd want rather than natural tearing, which, as I always say, make sure you research so that way you know which is which. Which, if you're watching this video, you're already halfway there. So a big question I'm always asked is every woman tearing? Like if I had a baby right today, is it going to be me? Am I going to tear? Or is it just first-time moms? So the answer is we don't really have a full one. Not every woman tears, but many do, especially if it's your first time. I mean, you know what happens. It's a lot. So perineal tearing can happen spontaneously because as baby's head is crowning, and while that sounds intense, I want you to know something very important. Your body is soft, it's elastic, and it's very capable of doing this. So the tears can vary in different degrees. I'm going to try to break it down and show a chart on the side here, but a first-degree tear is just the skin. It's superficial, and often no stitches are actually required. A second-degree tear, though, now that involves skin and muscle underneath, and normally 9 out of 10 times these usually get stitched. Whereas third and fourth degree tears go much deeper. Oftentimes they lead into the anal sphincter or the rectal lining. That's my face, and I plan to share that with you. They're much less common and are repaired in an operating procedure, as in like surgical kind of thing, often under anesthesia. So before this makes you anxious, remember that your birth team is very trained in what to do. It knows how to spot, it can manage these things and repair these tears, and you will heal, especially with good support. But what do you do when you are choosing to have a free birth? How do you know when to go in? These are very great questions. If you're having a free birth, always note that prevention is the best kind of key of medicine. But if maybe you didn't prepare for it and you're just all of a sudden now realizing you might have a tear, you're probably worrying what to do. Your first step is going to have to assess the situation. What does it look down there like? Are you going to look? Are you going to get your partner or a family member to look? From there, you're going to need to use images and books online that you can find with the graphic showing you what degree you would have. And from there, you could kind of determine your course of action, which would be possibly self-suturing, or would it possibly be going in to the hospital? Like, there's a few options that you have to determine when deciding what option of birth you're having, and if free birth is one of them, research is going to be your number one key of assistance here. Now, you might be asking, can we prevent tearing? And sometimes it's a yes, sometimes it's a no, but there are things that help. First off, the biggest one that everyone is going to recommend to you on your care team is perineal massage. In the very last few weeks of pregnancy, it can make a huge difference because it's teaching your tissues to stretch, which I will even share that if you're into a more alternative lifestyle in the bedroom, there are certain things that I'll try to link below that some people have even helped find stretching their vagina before childbirth has even occurred. Another option is controlled pushing, where you try to breathe baby out slowly instead of holding your breath and bearing down. It can help reduce the intensity on the perineum. And this one, a doula favorite, which is me, is a warm compress on the perineum as the baby head is crowning. So this is something that your midwife can do. Certain and select doulas might even offer, or might even provide that kind of support if that is something you choose, because it's soothing and it helps ease that ring of fire moment when baby's head is coming down. So actually, when baby's head is just about to be born, you may be asked to pant or do short breaths instead of pushing. That's not just for drama, and it's not to make a big scene. It's to give your skin time to stretch, to let your body do the final wave as baby comes out. It is very often beautiful, but also kind of scary, and a lot of times, if not prepared or not supported properly, you can feel uneasy about the entire situation. So, if, depending on your birth, you're going to have to wonder, which one is it in the end? Who's going to win, episiotomies or tearing? And honestly, to tell you the final thing, a drum roll please, a natural tear is most preferred because it's smaller, 9 out of 10 times it's superficial, and less comfortable in the recovery phase. But sometimes, depending on where you birth, if baby needs to come right now, or you need assistance from your medical care team, a provider may suggest an episiotomy, including a midwife. So in that moment, I really want to urge you to realize you have consent and you have options, and it is for you to decide. Now, 9 out of 10 times when people are in labor, they're like, get this baby out of me. So they're not often thinking about their options. But we want you to remember to use that brain mentality, or the bra method of benefits, risk, and alternatives. Remember that even in the moment, you still get to say no if you want. You deserve an explanation, and you still are allowed to ask questions, or even your partner for that sake. So often, like, can we wait a moment, or try a new position first, or what are the risks if we don't do it? So remember, you are allowed to speak up in your labor, in your delivery, and remember, you have a voice during that moment. So I want to remind you that birth is wild, it's raw, and your body knows how to do this. Your body knows what it's doing, even in the very messy, even the very middle of it. Because whether you tear or not, whether you have an episiotomy or not, you are not broken. You are giving birth to another human being. You are healing, and you are becoming a new person. So remember to honor your perineum, give her grace, make sure to bathe her in warm water, and speak positively, because that plays a really big impact into us. And above all, remember, don't rush the healing regardless of episiotomy or tear, because she was holding the space for you to bring life to pass through. So let's create a culture where we don't just whisper about these things in shame or fear. Let's have honest conversations about them. Let's talk about them and speak out loud with reverence. So if you've had an episiotomy or a natural tear, do tell us, even if you had both, below how your experience went. Because remember, you're not alone in this. You are loved and you are whole. And you've got this every single step of the way. Thank you so much for watching another video. Make sure to subscribe to find more tips just like these. Peace.